We'll start with Tomris Cesuroglu, and Tomris Cesuroglu is a medical doctor and a PhD. She's a physician and researcher who has been working on health systems and policies, global health, public health genomics, personalized medicine, and personalized healthcare and global health for over 2 decades. Her experience spans consultancy, biotech, healthcare, and academia in Turkey, the Netherlands, and Europe. Tomris?
Thank you very much, Ayssuda. Well, thank you very much the organizers for inviting me, Ayssuda and Gül here to present our experiences of our efforts about opening schools in Turkey who were closed down in the name of COVID for 1.5 years. I first need to start with some disclaimers. And that is at the time of the that I carried out this work, the voluntary campaign that we did together with Gül and Ayssuda. I was working at VU Amsterdam Institute. VU is easy, by the way, to say. Amsterdam University, Athena Institute as an assistant professor of health systems and innovation. And I was also working with the Turkish Medical Association's working groups on school health and pandemic areas. But later on, I moved to the Public Health Institute of the Netherlands. And since last year, I'm working at the National Institute for Public Health and the Environment of the Netherlands as a senior researcher in preparedness. And I still have an honorary position at the university. But just to note that the opinions I present today are my own and do not represent the views of my current or former employers. Just I need to emphasize it because I'm a civil servant at this moment working with the Public Health Institute, and just to put that disclaimer. So I first want to give you a little bit background to start with, and that is the school closures. So one of the first reactions of several countries when we were hit by COVID was school closures, closing down schools, because there was this idea that in other respiratory viruses, usually schools are the hub where, like influenza, that's where the kids get the virus from and spread at homes. And the initial thought was that it would be the same. And that's why one of the first reactions were to close down schools, which meant millions and millions of children. I mean, according to UNICEF, 168 million children affected from school closures, children and young people affected by school closures, for not weeks, not for months, for almost years. I mean, in the case of Turkey, it was 1.5 years. I know there are other countries who did even longer, for 2 years or so. So, but actually, and it was not just a few countries. It was the whole globe. It was the biggest educational interruption we have seen in the history of mankind, actually. So, but it was already in the summer of 2020, there were already reports saying that it was not the kids who were taking who were at risk. I mean, the COVID was sparing the kids actually, and which was something very positive. And it was the kids were also not the ones to blame when it came to transmission. It was the adults who were transmitting the disease, the youth also, and the adults, not the younger kids. And it was well known already by summer 2020, and various authoritative sources put that the benefit of keeping schools open outweigh those of closure very clearly. And interruptions have a very severe negative impact on children's physical, mental, and social health. So you should close down schools only if all the measures you have taken have not worked. If you have closed down everywhere, all the organizations, all the institutions that you know, then you can think of closing down schools. But in many parts of the world, including Turkey, it was the other way around. When the shopping malls were open, when holiday resorts were open, when all the businesses were going through, when factories were open, when the society was open, schools were closed. But so this was really something that touched our hearts with Gül and Aysuda, but I will come to that. But first, let me give you the background of Turkey a little bit, because it's my case for today, and I want to give you a little bit of the background first. So Turkey is situated just in between the Europe and Asia, also somewhere in between south and north. It's quite like a bridge, and it is also culturally a bridge between east and west and north and south, actually. And there's an 85 million population with about 5 million immigrants, mainly from Syria. The GDP per capita is 12,000 US dollars, but at this moment, and and it is classified as an upper middle income country, but be aware that the income inequality is a huge problem. And it was going better in the beginning of 2000s, but it started going worse back after 2010s, and there's quite some income disparity between different groups. And we have been having the same ruling party for 20 years, just to note also, with a rising period in the first part of 2000s, and then after 2010, the decline, I could say, both economically and also in terms of social rights. And the trust to state is quite evaded in that period. And overall, it is quite a highly polarized society. At the end of the day, with the majority party versus opposition, with different religious groups or with different ethnic identities, the polarization has been getting much worse. All of which have influenced, actually, the school closures that I hope I can show that a little bit. So, in the beginning of the pandemic, what we saw was that the measures that were taken against the pandemic, well, in a way, fluctuated between this end of the pendulum towards the other end of the pendulum. In the one hand, total lockdowns, like curfews, not lockdowns actually, curfews like in India, almost like India, where people could only go outside their homes only with certain authorizations. That was in the beginning put into place, but then it moved to the other way, where people were told, okay, everyone is on their own, you do your own lockdown, try to prevent going out and try to prevent mixing in social ways as much as possible. But what it meant was also that, that in order to prevent people to go out of their homes, one of the strategies used by experts and also the government was to put fear into people. So exaggerating the harmful effects of COVID so that people would confine their homes more. So telling that, well, young people also die, children also die, because, I mean, we're all mammals, okay, at the end of the day. And one of the biggest factor that triggers fear in our brains, in our amygdala, is something that is happening to our children. So once you trigger that point, then you can really put fear into people. And that was one of the ways that the experts exaggerated the impact of COVID on children in order to, well, with the good intentions, but as Dante said, well, the road to hell is paved with good intentions, actually. And also mandating masks for outdoor. When I heard Indian colleagues' stories, it sounded very similar from India. And also not transparent, data and information was clearly manipulated. And after the first months, the trust also evaded towards the state also. Also, we see a lot of similarities with other countries who had a polarized political background, like the USA. It was very interesting to see that the left wing was demanding more of the school closures, which is called, I think, left-wing authoritarianism in a way, and more strict measures. But at the end of the day, those who work, working class, need to go out of their homes, and they need to work at the end of the day, and especially those who are subsistently living in situations who had to earn wages in a daily way, they had to go out, of course, because the benefit system is not brilliant like it would be in Europe. So overall, there were big harms on mental and physical health and social well-being of 65 plus people, because they were locked down to homes for 3 months. So there was a total curfew for 3 months for 65 plus. Children and youth, also under 18, was included, and also the women, because they carried the burden at the end of the day, the whole system. And, oh, sorry, I wrote before summer 2021, but it should be before. Oh, yeah, that's true. So until summer 2021, the predominant perception was that schools spread the infection, lead to higher COVID-19 cases, which meant locking down 18 million children and young people into homes. Well, Aysuda, Gül and I couldn't sit back. We just couldn't simply watch this happening. So just to introduce Aysuda, she's going to present tomorrow actually and she's going to have a helicopter view of all of the things we're discussing today, I'm hoping. But she's a political scientist and currently based in Berlin and Bard College University. So she'll tell probably a little bit about herself tomorrow. But as a political scientist, she gave the analytical perspectives to what we were doing. And Gül was situated, Gül Pamukçu Günaydın was situated in the heart of Ankara. She's going to present in the next session as an emergency physician and have had connections with a lot of people in Ankara. And we also, sorry? Ankara is the capital city of Turkey. I'm sorry about it. And we were working in theory, spare times to move towards opening schools, which Gül is going to tell in the next session probably. From summer 2020, we started working on this topic. We started first informing mothers. We had quite close contacts with parenting circles in the social media because they were really afraid of their children's lives if the schools were opened, but also they were seeing the harmful effects of school closures. So they were really not knowing what to do and why to do. So we started spreading the news that the kids are not under risk, and kids and schools do not create a risk for society in times of COVID-19. But it wasn't enough, so we started meeting with stakeholders and analyzing the root causes of this problem. Why were schools, why can't we change this perception? There's something underneath that is more powerful than just communication. There is something underneath. And we did stakeholder analysis, we did root cause analysis, and and we made a report in December 2020 about explaining why and how the schools should be open and what were the underlying root causes of school closures in Turkey. So our analysis showed two main root causes. One was the education system first. So education system was already in trouble before COVID hit. That was why the school closures could be sustained so long. Education was not valued in the society with high-valued thing anymore. It was the intrinsic value of education to prepare kids to life, to add something into their mental and well-being, or in general to prepare them to life. That was long forgotten because schools became places where it was preparing children and young people to exams, because you need to go get the high scores in the exams in order to go to the next best school, and then you can go to the good jobs. So it's a very highly competitive society and a very highly competitive school system. And then if the schools are closed down, then because they are only preparing kids and young people to exams, if you find ways to prepare for exams, then there's not much harm seen by the larger groups of society. And also, because education lost value, the teaching profession also lost value, unfortunately. And they were not seen as, they lost their prestige in the society, and they lost their enthusiasm for teaching, actually, after long years of course, wrong policies, I should say. It's not just, it didn't happen in a year. It was already happening for decades and decades. So overall, yeah, it was the education system was caught in a very weak state when COVID came. And after once being closed down, that there wasn't a grassroots movement from teachers or students or families saying, hey, what's going on here? That voice never came up. Another thing was the power imbalances. Like in Turkey, I told you about this wide income gap. So there are different stratas of the society. So the high income, high educated groups are living in a different reality than the low income, low educated people. And so the groups that were harmed most were children, young women, youth, women, and in particular of those low income status, and also those families whose mother tongue was not Turkish. There were, in theory, a remote education through internet and online education, which definitely didn't work. I mean, many families didn't have laptop. Even if you had laptop, how long can you continue by looking at a screen? I mean, that was not education. It was just a theater show. Like, we are continuing education, it was said, but it wasn't working actually. So, but those who are in power positions, so all the cabinet, the government, and all in media, in politics, they were from high income, high educated groups. And their children were not suffering from in the beginning, of course. Their children were not facing these harmful consequences. But what we know is that if education is disrupted, especially when these young people start earning money, they never go back to education. Once they start bringing money to the household by starting in a factory or so, they don't come back to education. So it's not just the interruption of the education for so many months or years. It's that the school dropouts that make us feel worse. And those also young girls who got married because school was protecting them from being a cheap labor. School was protecting them from getting married in a young age. So, also the cabinet was quite largely men. Who didn't have young children. I think this representation is quite an issue. There were a few women, I think, in the government, in the cabinet, but at the end of the day, they also didn't have young children. So the situation of what women and children were living at homes were not totally visible. And there is a very prominent exam preparation sector in Turkey. So. And it was already running parallel to schools, the private tutoring and the private course sector. So when the schools were closed, they continued. They even had more clients at the end of the day. And there were teachers who had normally a governmental teaching job. They could also start doing private tutoring at homes. So, and of course, this was not the case for low-income groups. And because it's such a competitive system, probably the children of high income, high education class probably gained the competitive edge here, most probably. And but the children from low and middle income groups even came down were even further disadvantaged in the whole system. So the school closures became the status quo. This is the last slide. And overall, the argument that schools are risk for children and risk for society, this argument dominated the discourse. And even those opposition experts, clinical experts, propagated this, even when there was the scientific evidence and recommendations of authorities such as WHO and European Center for Disease Control was showing the otherwise. And so the whole policymaker, journalist, scientist constellation served to the agenda of probably the potential benefit of the high-income, high-educated groups. So it's not all or nothing. So this is something we always try to use as an argument when we were talking to especially clinicians or other people. So when a clinician, there is the term used collateral damage a lot. I personally, I'm not very favor of that because it's borrowed from military sector. I prefer to use unintentional consequences of policies as someone who has been working on health policy for long years. Because just like medicines have side effects, we know that policies have unintentional consequences. So this is not a surprise. And what you need to do is always, when you, just like you're prescribing a medicine, you need to look at the potential unintentional consequences of implementing a policy all the time. And you need to weigh the benefits over the harms. That's why, for instance, sometimes in cancer therapy, you choose not to give the chemotherapy because it will be even, you can kill the cancer, but you can also give much harm to the person. So these kind of balanced balanced approaches were missing. This is the art of public health, actually, the science and art of public health. So this was one of the main missing points that we had. So, yeah, Gül is going to present what we have done in Turkey in the next session, and Aysuda will give future insights in the next session. So thank you very much for listening to me.